Here's what to expect right after your baby is born from a labor and delivery nurse. As soon as baby comes out, they can come right onto your chest. For some skin to skin, we will dry and stimulate baby during this time and usually try to do about 1 to 2 minutes of delayed cord clamping. This is when your provider will give you oxytocin, also known as Pitocin, either as an injection in the leg or through the IV to help prevent any life-threatening postpartum bleeding. Giving this medication prophylactically is actually shown to reduce the risk of postpartum hemorrhage by 40%. After that, it's time to deliver the placenta, but don't worry, it's pretty easy after you've just delivered a baby. Some people don't even feel it come out. Your provider will then make sure to check your vital signs every 15 minutes for the first hour postpartum. After the placenta is delivered, this is when your provider will check to see if you need any stitches down below. If you do, they will make sure that you are numb with a lidocaine injection, or if you have an epidural, sometimes you don't need any extra numbing medication. Once the repair is all done, your providers will help clean you up, and then they will actually weigh your quantitative blood loss to make sure you didn't lose too much blood. I love making sure my patients are nice and clean after delivering their baby. Of course, it doesn't replace a shower postpartum, but it does help them feel a little bit fresher. And yep, that's a mama diaper. You and baby will definitely be matching for at least the first hour postpartum. For the next hour, this is when you can enjoy all those newborn snuggles and just relax, staying in bed, having some snacks while your nurse charts and comes in intermittently to check on you and baby. This is that amazing golden hour where you can also start your first feeding with baby. Your nurse will also perform what's called a fundal massage, where they actually check to make sure your bleeding is okay and that your uterus is nice and contracted down. You'll also get a postpartum pad that has some ice in it, some Tux pads, and some lidocaine gel, which is just some numbing jelly, and this really helps with any swelling that you might have down below. After this first hour postpartum, you're going to want to get up with the help of your nurse to go to the washroom. This really helps to mobilize after having the baby. They will actually take out your epidural at this time if you had one, and then help you to use the peri bottle and put on an underwear and pad if you prefer that over the mama diaper. And then you're off to postpartum for the next 24 hours until you can go home with your new bundle of joy.